One thing that we know about mild equine asthma is there is a possibility that we can reverse the course of that disease and not see those horses become severe equine asthmatics down the road. So it is better to catch it early if we can. Equine asthma is represented in mild, moderate, and severe forms. Most people are pretty familiar with the severe form, where you would see a horse that's coughing frequently, has increased respiratory effort at rest, and an increased respiratory rate. In the mild to moderate asthma case, horses may only experience cough maybe at the beginning of riding, or perhaps a little bit when they're eating. And so oftentimes I found in practice that owners might think that that was kind of normal. You know, my horse coughs a few times at the beginning of exercise, but he works out of it and he seems fine. But really, if your horse is coughing with regularity, that's not normal. Horses diagnosed with equine asthma have a general decrease in performance. If you have an elite performance horse and you notice a decrease in performance, endurance, your horse gets more winded, that can be pretty obvious. But if you're not asking your horse to perform at a high level, you may not notice a change in their performance. So the strategy for treating equine asthma is really two steps, plus or minus a third step. The first step is to modify the environment, and that is so important, and it's often the most difficult step. And so that's going to be reducing the amount of dust in their environment as much as we can. Don't feed round bales, for example, because our horses like to bury their head deep in the middle of that round bale. Making sure that we take the horses out of the barn when we're cleaning the barn. And even nets on bales also unfortunately increase dust as well. So really trying to do everything that we can to clean up the horse's environment and make it as dust-free as possible. Then number two would be treating with a corticosteroid, because asthma is an inflammatory disease where we see inflammation in the lungs, and corticosteroids are strong anti-inflammatories that reduce that inflammation. So we can treat with a systemic corticosteroid or a targeted corticosteroid. In the case of systemic corticosteroids, it's just how it sounds. It goes throughout the horse's entire system, and it can affect other parts of the horse's body besides the part that we want to affect. When we look at targeted corticosteroids, we're actually trying to put that medication right where the inflammation is, which in the case of equine asthma is deep in the lung. Every horse is different. Every situation is different. So your veterinarian is going to take into consideration, what are your goals for your horse long term? Where is your horse housed? Is your horse at home, or is it in a boarding facility? Does your horse have any other risk factors like PPID or EMS? And all those things will come into play before you can make a choice about what corticosteroid to choose. I'm Dr. Jamie Pribyl, and together with your equine veterinarian, we can master equine health.